The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. And today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it is great seeing you.
Great seeing you, Shay.
Today we are going to talk about a more natural way to increase collagen production in our skin. I know I certainly tend to like doing things the natural way.
Mhm.
So please tell me, what do you
Well,
have there?
collagen is one of those things that's a buzzword. We're drinking collagen, we're applying
Right.
collagen to the tissue. It's a big buzzword out there if you look in the beauty magazines and in the
Hmm.
industry of healthy aging. So, but basically, there's only one way to really stimulate collagen in the tissue, and that's through either like creating micro damage in the tissue or putting something in the tissue that acts as a stimulant to make the cells actually produce more collagen. So we can do that by heat and microneedling with lasers and microneedling devices and radio frequency devices, or we have a product called Sculptra, which has been around since the late 80s, used for HIV wasting in the temporal region. So it's been around quite a while. But we use Sculptra when we place it into the tissue, it actually stimulates the fibroblasts to produce more collagen. So it's a what's called biostimulator. It is not a filler. It basically goes in, and the little tiny crystals that are in the product actually stimulate the fibroblast to produce more collagen in the area where it's placed.
Okay.
So you get a natural boost of collagen in the tissue and what they call a glow to the tissue. And so it's nice to use, especially in patients who are seeing an accelerated aging in their face and they're starting to get, laxity of the tissue and a dullness to the skin. This can be used in conjunction with hyaluronic acid fillers to really rejuvenate the tissue. It also is great for preventing loss of collagen, so it serves as a dual purpose, both in prevention and in treatment. It's great for most patients coming in. We use it in combination with our hyaluronic acid fillers. I definitely don't think it's a replacement for HA fillers, but I think it's a complement to them. And it makes the skin just look truly amazing. I also recommend it for patients whose skin is thinning as they get older.
Uh-huh.
It's a great way to stimulate that tissue to thicken and become stronger and more resilient with the collagen.
How
Um,
long do the effects typically last, Dr. Chapman?
so it takes about, once the product is injected, it takes about 6 weeks for it to actually start working and you see the results of it. We recommend 2 different treatment sessions, and then it's about yearly that you get just a little boost
Okay.
of it every year. That it's something that is pretty much ongoing as long as you give a little boost to it once a year.
Right.
The initial treatment is obviously a little bit more involved, but then the touch up is usually 1 vial a year,
I
which is
see.
not much just to keep things
Just a
out
little
of the
boost.
point.
Okay.
Yes.
Your booster.
The
Okay.
Sculptra booster, right?
Okay.
So it works very nice. It's very safe. It's very effective. And we see lots of good results with it.
Well, good to know, Dr. Chapman. Thank you so much for being with us and for sharing the information. We hope you'll come back.
Thank you for having me.